Good day, everyone. Today, I will talk about application of artificial intelligence in oncology. In particular, I will talk about how AI technologies are transforming cancer diagnosis and personalized treatment, as well as the ethical challenges that this innovation pose to us. Why this topic is important? First of all, the use of artificial intelligence in medicine, particularly in oncology, is expanding rapidly. With advancements in machine learning and deep learning algorithms, AI has started to play a crucial role in analyzing medical images, predicting disease progression, and personalizing treatment strategies. However, these technologies do not come without challenges. Alongside the clinical benefits, the integration of AI raises essential questions about transparency, accountability, and bias in healthcare. This brings us to the ethical and philosophical dilemmas we will explore during my presentation today. The first part of this talk will focus on the practical applications of AI in oncology, highlighting its diagnostic potential and role in disease prognosis. In the second part, I will explore the bioethical challenges that arise with AI-driven decision-making in patient care, focusing on issues such as patient autonomy, transparency, and fairness. My objective today is to demonstrate both the opportunities and the limitations of AI in oncology. Ultimately, I hope to provide a balanced perspective on how AI can complement clinical expertise, improve patient outcomes, and what ethical safeguards are necessary to ensure responsible implementation. First of all, AI can handle complex datasets. AI algorithms have the ability to process large, complex datasets from different sources, such as clinical data. For example, it can be patient history, laboratory results, electronic medical records, and so on. Also, it can be genomic data, DNA sequencing and gene expression profiles. And of course, it's medical imaging, radiology, histopathology, and molecular imaging. Traditional diagnostic methods rely on manual review, but the growing volume of data makes it challenging for human experts to analyze everything efficiently. AI tools help to streamline and optimize this process, ensuring these patterns are not missed. Also, this is enhancing diagnostic precision with specifically, for example, convolutional neural networks, also called as CNNs, are particularly effective at processing histopathologic images. For example, AI system trained on digitized pathology slides can detect cancerous changes at a cellular level even before they become visible to the human eye. This enables earlier intervention, which is crucial for improving patient outcomes. Also, it real-world application. Nowadays, there is plenty of research that utilize deep learning tools to analyze histological data, achieving an accuracy rate of 92% and even more in distinguish malignant from benign lesions. These AI-driven tools can act as a second readers also and reducing the chance of diagnostic errors in cancer detection and aiding pathologists in their decision-making. Also, AI can predict disease progression. It also being used to predict the likelihood of disease recurrence and the spread of metastasis based on patient-specific data. Predictive models trained on historical data can identify patients at higher risk of recurrence, helping clinicians to initiate more aggressive follow-up or treatment earlier. Also, AI supporting personalized treatment strategies. Um, Predictive insights generated by AI allow physicians to tailor treatment plans based on each patient's individual prognosis. For example, a patient predicted to have a higher risk of recurrence may benefit from intensified therapy such as adjuvant chemotherapy or radiation, while low-risk patients can avoid unnecessary interventions. AI also helps guide real-time treatment adjustment by evaluating patient responses, ensuring that therapies remain effective throughout the course of treatment. And my key message is that we must collaborate with AI because AI supports early detection, personalized care, and it should be complement, not replace clinical expertise. Let's move to ethical and philosophical challenges. First of all, it's patient autonomy, of course. Many AI systems, especially those using deep learning models, operate as black boxes. This means that even the developers and physicians using the system may not fully understand how the AI reaches its conclusions. For patients, this creates challenges to informed decision making. If they do not understand how or why AI tool made a specific recommendation, their sense of control over their treatment may diminish. For example, for physicians, the black box issue is also challenging. In traditional medicine, doctors are responsible for explaining their clinical reasoning to patient. But if an AI recommendation is opaque, doctors may struggle to justify its advice, potentially affecting their relationship with patient. I think that autonomy is a core ethical principle in medicine that emphasizing that patients should make informed decisions about their care. To respect autonomy, physicians must explain how tools contribute to treatment decisions in a way patients can understand even when the algorithm itself is complex. So I think we need such solutions like developing user-friendly interfaces and visualizations that explain AI predictions, and also we should involve patient in shared decision making, ensuring that AI recommendations are integrated alongside clinical expertise and patient preferences. What about transparency and accountability? AI tools introduce questions of accountability. If an AI system misinterprets biopsy result and making the diagnostic error, and then the patient receives incorrect treatment, who is responsible for this? Physician, the hospital, or maybe the AI developers? Uh, we don't know. In traditional healthcare settings, physicians bear legal and ethical responsibility for patient care. However, with AI tools in the decision-making process, this line of accountability can become blurred. So we need to ensure transparency, because transparency is crucial for building trust in AI systems. Clinicians need to understand how AI algorithms arrive at their conclusions, so they can communicate effectively with patients. So I think that solutions that is we need implement clear documentation on how AI models are developed, validated, and also updated. What about biases and fairness? AI models are only as good as the data they are trained on. If the datasets contain biases, such as underrepresentation of certain demographic groups, AI tools may generate biased outcomes. For example, if training data primarily includes male patients and only male, the AI may underperform in diagnosing diseases in women, reinforcing gender disparities in healthcare. So, what strategies for mitigating biases? Bias detection and mitigation are critical for ensuring equity in AI-assisted care. We need to ensure that training datasets are diverse and representative of different patient populations. We need to provide regularly audits for AI models for biases and update them with more inclusive data. Also, we should integrate ethical guidelines into the development process to minimize systemic bias from outset. So, what can be a key message? These ethical concerns emphasize the importance of transparency, accountability, and fairness in AI-assisted healthcare. We should work on transparency, accountability, and fairness. Balancing AI and clinical expertise. First of all, we should understand the proper role of AI as a support tool, not a substitute of physicians. Physicians have the responsibility to interpret AI predictions within the broader clinical context of each patient's unique case, ensuring that data-driven recommendations align with real-world situations. Also, we must go beyond AI-generated predictions. They need to incorporate multiple dimensions, such as, for example, patient preferences, psychological factors, mental health, anxiety, emotional well-being also play crucial roles in treatment adherence and recovery of the patients. And also we need to check potential side effects, because balancing the benefits of aggressive treatment with potential risk and side effects are essential and crucial for clinical oncologists like me. And also it's shared decision making. AI can provide physicians with valuable predictions, but the final treatment decisions must remain only in the hand of clinicians. AI insights with personalized advice. And also, another very interesting question, it's about empathy and human understanding. AI lacks empathy and moral reasoning because there are many limitations of AI. For example, while AI excels at processing data, it cannot replicate empathy or moral reasoning that are essential in a cancer care. Oncology often requires difficult conversations about prognosis and treatment options, where human compassion plays a central role. AI tools are not equipped to address the emotional complexity that accompanies these situations. Also, patients need to feel that their care is guided by human compassion and clinical expertise, not just by algorithmic predictions. For example, patient facing the end of life decisions may prioritize emotional support and comfort over treatment recommendations based solely on survival statistics. So I think that trust is a key component in oncology care. Patients are more likely to follow through with treatment plans when they feel understood and supported by their physicians. Empathy strengthens the physician-patient relationship, ensuring that treatment remains patient-centered even when AI tools are involved. While AI can imitate some aspects of empathy, for example, GPT chat, of course, can imitate empathy, but it cannot truly feel or express it. The goal should be for AI to function as a complement to human care, enhancing communication and providing comfort without replacing the essential human connection that doctors bring to oncology. This way, we can use AI not only to make smarter, data-driven decisions, but also to support patients in a way that respects both their medical and emotional needs. What about future directions in AI-driven oncology? First of all, is regulatory frameworks. We need to continue monitoring and validation. AI tools in healthcare must undergo rigorous validation and monitoring to maintain their reliability and accuracy over time. As healthcare data evolves, AI models require regular updates, as I said, to ensure the predictions remain clinically relevant. And also, there are must be regulations for transparency and accountability. There is a need for regulatory frameworks that clearly define responsibility, whether with clinicians, hospitals, or developers, if AI tools make incorrect predictions. And also we need clear guidelines that will ensure that AI systems meet clinical quality standards and maintain accountability for patient outcomes. Also, there are plenty of work for us. For example, it's education. Not only physician education, oncologist, but also education for patient, because patient awareness is equally important. Patient must understand how AI contributes to their diagnosis and treatment to foster trust and transparency in care. For example, explaining in simple terms how AI predictions complement clinical expertise can alleviate concerns about AI acting as a black box. Also, we should work on bias mitigation strategies. To avoid systemic biases, AI tools must be trained on diverse datasets that reflects broad range on patient demographics, including gender, ethnicity, and socioeconomics backgrounds. This will ensure that AI predictions are accurate and equitable across different patient populations, preventing disparities in care. Also, implementing regular bias audits, as I said, and of course, it's collaboration between data scientists and ethicists will be essential to develop algorithms that are both clinically effective and socially responsible. So my key message on the future of AI, that for all the promise of artificial intelligence in helping treat diseases, there are still many important questions to be answered. Who is liable if a robot makes a mistake? Will robots be overused to pad billing codes? And will this practice result in more errors? How can we best balance innovation with safety? So let's go to the final takeaway and conclusions. In conclusion, artificial intelligence has the potential to revolutionize oncology by significantly improving diagnostic precision and enabling personalized treatment strategies. And also, AI-driven tools can enhance our early detection, predict disease progression, and support clinicians in making more informed decisions. Of course, however, the adoption of AI in oncology must be approached thoughtfully. We need to address critical ethical challenges, ensuring transparency in AI algorithms, maintaining fairness across diverse datasets of patient populations, and establishing clear accountability for AI-assisted decisions. AI must complement human expertise, not replace it, preserving the essential role of clinicians in delivering compassionate and patient-centered care. Thank you for your attention.